Hello everybody, welcome to another episode of Ask Dr. Bob, and we just love and appreciate all the questions that we have sent in from email, on Facebook, and today I want to take a few moments because last week I said I would discuss spring vegetables. The springtime, lettuce, asparagus. Asparagus is awesome because there's so many vegetables out there that people don't know what to do and how they impact their health. Asparagus is like a well-kept secret, and the springtime is the very best time to have asparagus, and I cook mine on the grill. You just put it on the grill and sprinkle a little bit of olive oil on it. Radishes are also a springtime treat. Let me tell you a little bit about radishes. They're great for digestion. They're actually a bitter herb, and I was doing my studies for my natural health degree. I had to take a lot of classes on herbology. Bitter herbs promote digestion. Radishes are bitter herbs. So if radishes cause digestive distress, it could be your liver gallbladder. Lettuce, any type of lettuce with that green leaf and chlorophyll and magnesium is good for healing. And all you ladies over 50 years old right now, heart palpitations, you can see improvement with magnesium. So eat your kale, it's the new beef. Dr. Bob, what's the best way to boost my testosterone? I'm having libido problems and erectile dysfunction. I'm a 69-year-old man. Well, I can tell you, I have patients in their 40s that have erectile dysfunction right now, and a lot of it has to do with stress and soy products. See, soy has a lot of estrogen in it, and it impairs male hormonal function. So watch your soy consumption. I know a lot of men are exhausted today. We support adrenal gland function. Make sure you're eating red, yellow, and orange bell peppers. And I know even Dr. Oz shared this on one of his programs one time about maca root. Maca root is readily available. Maca root is going to help improve male libido, the improvement of testosterone. I'm going to tell you one thing I want you to be aware of, though, is if you start taking testosterone patches, there's an enzyme in your body called aromatase, or there's an enzyme called aromatase that can convert testosterone to estrogen. So I know a lot of men use these testosterone patches on their body. Not really a smart thing to do. You want to improve adrenal gland function, focus on protein, vitamin C, red, yellow, and orange bell peppers, and make sure you're getting plenty of sleep. Stay away from eating sugar. Next question. Dr. Bob, I have dry throat from a condition. There's a lot of different ways that you can say this. Sjögren's syndrome, which is dry eyes. Now there's a lot of different reasons that somebody can have dry eyes, and they talk about the glands being inflamed and not releasing the tear ducts. We actually help our patients with dry eyes by supporting them with iodine. You'd probably want to talk to your healthcare provider, have a TSH, a T3, and a T4. See, sometimes if your thyroid is low, it's going to impair function. But iodine helps promote iodine flow. Iodine has helped promote the tear duct flow. We just see that happen over and over and over again. And I also know if you're underneath a lot of stress and your adrenal glands are going 100 miles an hour, dry eyes can result. Dr. Bob, I've had uncontrolled shaking in my hands. What do you think? It's kind of an interesting question because this week we had a patient of ours that came in and said the exact same thing. And I want you to know that when I was going to college, back in the 1970s, when we used to study, some of my friends would have shaking also is because they were doing too much caffeine. But this individual that came into our office this week and we were talking happened to have chronic allergies. And we looked up the medication he was taking, and one of the effects of the medication was shaking. Now I have many patients that come into our office. You know, I'm not here to tell you not to take your medication, but this is what I know. Medications have bad effects. What I have to do is watch TV in America for any length of time, and they get really quiet when they start talking about all the bad effects, including death. So I want you to know, especially allergy medications right now, look at the side effects. It could be causing some of your body signals. Dr. Bob, what do you think about parasites being a part of our system and long-term health? Well, I do want you to know that recent reports say that up to 80 million Americans could have issues with parasites. And one of the most common body signals, grinding your teeth at night, waking up at 1 or 2 o'clock in the morning. And there's a lot of products that you can use to help take away parasites. Here's what you really need to do. Increase your sulfur. Parasites don't like a sulfur environment. Onions, egg, garlic, sulfur. Parasites hate sulfur and stay away from sugar. Dr. Bob, what causes rashes in the sun? Well, here's a very simple answer. Sunshine takes the cholesterol in your skin, converts it to vitamin D. Vitamin D takes calcium from your intestine and puts it in the blood. A lot of times if someone has sunshine exposure and they start to notice some rashes on their body, I often suggest calcium. You may need some more calcium. You might not have enough calcium in your diet, or you may have a lot of stress causing cold sores. I can tell you, stress causes an acid pH. An acid pH has to be neutralized by a mineral. Calcium is commonly used. If you have chronic rashes, possibly due to the sun and or cold sores, think calcium. We use a acid calcium, calcium citrate, or calcium lactate. Very exciting to help that individual. Next week, what are we going to talk about? How you can sleep better. You know, there's a lot of people take a lot of medications. People don't have enough sleep, and sleep is really important for growth hormone. I appreciate each and every one of you. Pass this information on. We just want to make a difference in your life. I'll see you next week.